Have you ever heard the expression, "I'm so hungry I could eat a horse"? Well, in the equestrian world, there are actually many eating disorders. My speech today will examine the complex world of eating disorders within the equestrian community. We'll look at factors contributing to these disorders, including the pressure of perfectionism and the unique challenges of balancing athletics and body image concerns. A healthy, supportive environment within the equestrian world will also be examined, as well as the impact on riders and their horses. As I shed light on this important issue, I aim to promote awareness, understanding, and ultimately positive changes in this community. So, you might be asking yourself, what is equitation? Equitation is a type of equestrian competition that is judged entirely on the horse's skills, including form, balance, and control, which are all very necessary components of riding a horse. How is equitation judged? This type of competition is judged both on the flat, and that would be just walking, trotting, and cantering the horse, and it can also be judged over fences, and that just means that the rider has to navigate over a course of jumps. How well the horse does in this competition is not taken into consideration when being judged. So what is an eating disorder? An eating disorder is a type of behavioral disorder mainly categorized by several and persistent disturbances in catting behaviors. People who suffer from eating disorders often focus on their food intake, weight, and shape, and may have anxiety about eating a certain food or what consequences they will face if they eat that certain type of food. Eating disorders affect several million people at any given time, and the most common disorders are anorexia, bulimia, binge eating disorder, and abstinent restrictive food intake disorder. So what is anorexia? Anorexia is a type of eating disorder in which a person may starve themselves and have severe weight loss, and may result in a low height or weight from their age. Many people who suffer from anorexia have a significant fear of gaining weight and may diet and exercise excessively. There are two main types of anorexia, one being binge eating and purge type, where the person will binge and then vomit and use laxatives in order to prevent weight gain. And then there is restrictive type, in which the person who has it will lose weight by fasting, dieting, and exercising excessively. Anorexia can cause serious medical complications and can become life-threatening if not treated. Bulimia. Bulimia is an eating disorder in which a person who suffers from it intermittently diet and eat low-calorie foods and then binge eat lots of higher-calorie foods. Binge eating occurs at least once a week, and this is typically followed by behaviors that will prevent weight gain. This behavior may include fasting, vomiting, laxatives, and an excessive exercise. People who suffer from bulimia can be overweight, underweight, or even have a normal weight, and since these behaviors are commonly hidden by family members and friends close to these who suffer, many don't even notice. The background on the Big Egg. There was a demand from trainers and judges for riders to be physically fit and small, which led to the Big Egg diet being developed. It was said that a rider needs to be in good shape, and that can't happen if they are more than a size 6. In addition to that, it was believed that a rider should fit into a certain mold, which is tall and thin. The history of the Big Egg. As far as we know, there is not much information about the history of the Big Egg diet, but from what we know, As of now, it is believed to have originated about 45 years ago and has been going on ever since. Today, it is less of an issue with riders getting judged on their size. Most aren't judged on their size as much as they were in the past. However, many judges still prefer riders who are tall and thin to compete. So, as we heard before, the Big Egg diet, that our ideal is lean and tall. It leads to eating disorders and eating little to nothing to quickly lose weight and keep the weight off for competitions. College equestrians. A study done by South Carolina State shows that prevalence of eating disorders is 42% in about 138 participants. 38.5% were English riders and 48.9% were Western riders. Viewed body size larger than it truly was, and wanted to be smaller and normal and competitive clothing. So male versus female. 42% of female collegiate equestrians are at risk of eating disorders. Most female riders are targeted for how they look. The equestrian world is mainly also female dominated. There's more female riders than there are male riders in this. So in this speech, I went over equitation, defining it as an equestrian competition solely judged on the rider's skills rather than the horse. It also went into eating disorders, explaining them, and discussing anorexia and bulimia. Furthermore, explored the background of the Big Egg diet in the equestrian world. Lastly, I presented a study on eating disorders among college equestrians, highlighting prevalence, rated, and gender differences. The strength of the rider and horse partnership and the harmony of the movements are more important in the connections between horse and rider than the size of the rider. We must also prioritize the well-being of both rider and horse in order to foster a culture of acceptance, support, and respect within the equestrian community. Let us gallop together into a world in which compassion and passion begin, where kindness and beauty go hand in hand. Thank you for watching my video.